Good day to all of you. Today's session is about the prenatal assessment. In the previous class, we learnt about the paternal factors influencing on prenatal development. They are like exposure to marijuana or tobacco smoke, lead, large amounts of alcohol or radiation, DES or certain pesticides. Men who smoke are at increased risk of impotence and of transmitting genetic abnormalities. Men with high lead exposure at work have an elevated risk of fathering a premature baby or one with low birth weight. Men exposed to nuclear plant had an elevated risk of stillbirth. Father's use of cocaine can cause birth defects in his children. Later, paternal age is also associated with increased risk of several rare conditions including Marfan's and dwarfism. The learning objective of today's session is to know different prenatal assessment techniques for identification of problems, issues and defects during prenatal development. To know the functioning of prenatal assessment technique, to understand the implication of different prenatal assessment techniques. Session outcomes are students would have understood about various prenatal assessment techniques for identification of problems, issues and defects during prenatal development, the functioning of the prenatal assessment technique, the implication of different prenatal assessment techniques. Various types of prenatal assessment techniques include sonogram, amniocentesis, chronic villus sampling, embryoscopy, pre-implantation genetic diagnosis, umbilical cord sampling or fetal blood sampling, and that is called as the blood sample. First one is the amniocentesis. In amniocentesis, a sample of amniotic fluid which contains a fetal cell is withdrawn and analyzed to detect the pressure of certain genetic or malfunction defects and all recognizable chromosomal disorders. Amniocentesis is usually recommended for pregnant women ages between 35 years and above. Both amniocentesis and the other method called as an ultrasound can reveal the sex of the fetus, which may help in diagnosing sex-linked disorders also. Second is the chronic villus sampling. In this chronic villus sampling, tissues from the ends of villi, that is an hair-like projection of coryn, the membrane surrounding the fetus, which are made up of fetal cells, are tested for the presence of birth defects and disorders. This procedure can be performed between 8 and 13 weeks of pregnancy and it yields within about a week. However, there is almost 5% greater chance of miscarriage and neonatal death after CVS than compared to amniocentesis. Third method is the embryoscopy. It is through this method, embryoscope is going to be inserted in a tiny viewing scope into a pregnant woman's abdomen. It can provide a clear look at an embryos as young as 6 weeks. The procedure is promising for earlier diagnosis and treatment of embryonic and fetal abnormalities. To summarize this session, prenatal assessment includes assessments like sonogram, amniocentesis, chronic villus sampling, embryoscopy, and the other methods. In amniocentesis, a sample of amniotic fluid is used to detect the pressure of certain genetic or malfunction defects and all recognizable chromosomal disorders. In CVS, fetal cells are tested for the presence or absence of birth defects and the various disorders. Embryoscopy procedure is promising for earlier diagnosis and treatment of embryonic and fetal abnormalities. Thank you.